Thank you so much to Lauren for joining us. Dr. Lauren Trosh is a PT, a pelvic PT expert in Washington, D.C. She volunteers her time both with the APTA Academy of Pelvic Health and IPPS and other platforms as well to help improve access to pelvic health floor education and also to improve patient care outcomes. So really lucky to have you chatting with me today. And I was just wondering if you wouldn't mind sharing a bit about your practice, your background, or if there's certain kinds of chronic illness or chronic pain that you love working with or you see a lot of.
Yeah, of course. Well, thank you so much for having me, and it's always a pleasure to chat with you. I'm sure we'll talk about this later, but multidisciplinary care is so important. And I think the more we can connect, the better, and the better it serves our patients as well. So, like you said, I practice in downtown DC. I'm a pelvic floor physical therapist, so um, what can I say about my practice? I'm so horrible at this part. It's a small practice in DC. We try to make things, I'm sure like you do in your clinic, as nice, very welcoming, one-on-one care. And I really make an effort to try to make it as comfortable for, both my patients and myself too. We all want a nice place to work as well. So I work in DC one-on-one, and we try to create a really nice environment for our patients. I guess my background, I actually started in orthopedics for the first couple of years of my practice. Um, and then got into pelvic floor physical therapy. And since then have been doing primarily pelvic floor physical therapy ever since. But with that orthopedic background, it's quite nice because oftentimes,
Mhm.
everybody is a whole person, and sometimes it's not just things going on at the pelvis, but kind of beyond that in the back, hips, that sort of stuff. So I think my background allows for a little bit, at least physically, that whole body approach. And then, of course, as you know, the mind piece is so important, which actually is pelvic floor physical therapist. I think working with persistent pain is something that we all have a level of skill with, but that only
Mhm.
takes us so far, and having nice mental health or behavioral health professionals really, really helps with our patient outcomes as well. I think what sort of my first love in pelvic floor physical therapy was helping out people who were having difficulties with their sexual function,
Mhm.
most commonly due to pain and
Absolutely.
pain conditions. So seeing a lot of vulvodynia or pain in the vulva, or specifically vestibulodynia, pain at the vestibules, and vaginismus as well. So I think that is has been my first love in the field of pelvic floor physical therapy, and I've continued to love treating that. On top of that, it's so hard to pick a favorite things that I like to see. I feel like in treating, helping people with their sexual function, we can make such improvements in their quality of life just with a
Mhm.
little bit of education. It can go a really far way with our patients because our educations about our vulvovaginal anatomy is just, or sexual health is really not
Mhm.
there. So being able to give people even just a little bit of information to empower them and help them feel better is nice. So I started there, but I'm like, oh, I also love helping my patients with other persistent pain conditions like endometriosis,
Mhm.
Um, I think that can be really nice for a set or group of people. Now, I hope you're seeing this too, that it's getting a lot better. Earlier on, it would be,
Yeah.
patients who had maybe seen, I don't know, 7 to 10 providers before they even got an accurate diagnosis about their, chronic pain or persistent pain illnesses. That I think that's getting better. But just to be part of that team or help people to kind of get where they need to be to improve their quality of life, to be able to, whether it's improving their sexual health or even their physical health and
Mhm.
being able to exercise or go to work or school, all of that can be super, super rewarding.
Absolutely. And these things I feel are getting more awareness, more education, especially endo. There has been a lot of, I think, push to get the word out and to get better screening. With that, too, I wonder if maybe that movement will come with vaginismus and vulvodynia, if that still feels like even more taboo or stigma associated with that. I don't know if, like, thinking about barriers to healthcare, I just think there's such a taboo to even start realizing that there's a problem or that that pain isn't normal, and they maybe go to you and they're finally doing this treatment to help with that pelvic pain. But maybe a barrier to the mental health care side of things is that they're going to have to explain it, or a mental health provider might say, like, this is a psychosomatic issue. Or I'm just wondering if any of those things ring true for you as things you see as barriers.
For sure. I think you are right. I think there's been a lot of, I think, money kind of put into endometriosis and, campaigns that, like, missing school, is
Mhm.
really not a normal sort of thing, and having to miss work. And I guess school and work and all these things are really valued in our culture. Not that, sitting or, being able to go to the bathroom comfortably, or, having, satisfying, sexual experiences isn't also really important. But I think it's
Mhm.
really kind of, oh yeah, if you're missing school and work, you should definitely get help for that. But if it's like, oh, kind of bringing up your urinary or bowel or sexual function, I think that's a really hard thing to do. And I think as well, another barrier is, a lot of providers don't know what to do with it.
Mhm.
They might not feel comfortable with it as well, which of course, like, we all have our different strengths. Like, I don't want to deliver your baby, and I don't want to, I can't treat infections. And,
Yeah.
there's amazing providers who are literally saving lives out there. But sometimes when people don't exactly know what to do, um, I think, patients can have some, negative experiences there. I'm sure you see it as well, where
Mhm.
our patients who have, even if they have the courage to bring up, some of the
Mhm.
problems that they're having, sometimes it doesn't lead to a positive outcome, or even worse, it can be a little bit traumatic.
Yes.
So of course, this doesn't make you want to bring it up with yet another provider, which makes total sense.
Absolutely. And I think there's such a fear, I would imagine, among, I think probably around therapists too, but even, like, medical providers such as yourself or OBGYNs, to say, I'm not sure, or I don't know, but let me look into it. And I think leaning into that in such a vulnerable way actually shows that you're willing to learn for your patients or clients, or you're willing to make sure you give them the best care possible. But certainly, that medical trauma can develop and build if you've gone to one, two, three, four, five doctors trying to figure out what's wrong, and all of them kind of push you on to the next person.
Right, right, for sure. And I think you and I are very lucky in the places that we practice in New
Mhm.
York and in DC, that we have, excuse me, a lot of wonderful providers to refer to. And I know I say, I'm really not sure about this. Let me give you a couple of names. Let me send you over to them. Let me, chat with them. But I know that we're very lucky, and that a lot of other places might not have, mental health therapists who specialize in persistent pain or pelvic, they might have one
Mhm.
pelvic floor physical therapist in like a 50-mile radius, or,
Yeah.
they definitely don't have a provider who can, uh, you know, even know or perform like what a vestibule is. So,
Yes.
sometimes the resources just aren't there, as well.
And these platforms that you have given a lot of your time to for pelvic health education, like having those resources out there for every doctor, but also every patient that's curious and trying to learn more about their condition, that evens the playing field, for those patients trying to get to the bottom of that, but a lot of mental load on them. But I think there's also a lot more, thanks to the work that you do, a lot more access for providers to gain more knowledge too, and they feel more equipped in those moments.
Yeah, I think, a nice thing that I think we're reflecting upon is that things are definitely getting better.
Hmm.
And I think we're even seeing it in like the last, 10 years or so that there's fewer and fewer people who are coming in having had, 7 to 10, doctors seen in like 10 years of trying
Hmm.
to get a diagnosis. Everything does seem to be moving in a more positive direction, whether it be because of like better educational resources or better training. It does seem like there is some bright lights out there.
Yeah, yeah. And since both of us are so passionate about a multidisciplinary approach, like I respect what PTs are able to do so much. Like, I cannot help you move your body safely. I cannot prescribe as a, urologist, or a OB can prescribe to treat infections, right? Like, we need everyone. What do you see as benefits when you have clients that and patients that really embrace that multi-system approach and they've got that team behind them?
I think, and sometimes, I'll have a patient who is coming in who maybe their tissues are just so irritated that it's like pelvic floor physical therapy is going to be torturous for you. This isn't
Hmm.
going to be a good experience at this moment. But to be able to say,
Hmm.
like, hey, see this provider, they're going to be able to prescribe you something or give you some help to calm this down. And then instead of having, X number of pelvic floor physical therapy treatments at the end of the day, we feel like has not been successful, we can have a visit, a couple of visits saying, I think this might not be the best path. Let's save our time, let's save our energy.
Yeah.
Let's have you see this provider, spend a couple like, weeks or months with that treatment, and everything can just be like so much more comfortable and so much more of a positive experience. I mean, the same thing with, a mental health provider.
Hmm.
As pelvic floor physical therapists, I think we try to make our treatment rooms as comfortable as possible.
Yeah.
But then again, and we don't with our patients. Every patient does not need an internal examination.
Hmm.
But for some people, they actually want to do that.
Hmm.
They're really interested in those treatments to help them. But if it's hard for you to even lay on the table without, your legs shaking, maybe it's best to have a little bit of time to talk with a mental health provider and really get you in a nice, better position so that, you're not lying down on the table and feeling like you're going to pass out or something like that. Of course,
Yeah.
a pelvic floor physical therapist, we have a lot of patients who, come in, I'm fine, I'm fine, I'm fine. We can do this.
Yeah.
And you're reading a lot of, body language, a lot of things, a lot of dissociation, a lot of things that might indicate that, we're just not ready for this part of the treatment. We can do so many other things that might be helpful, but let's have
Yeah.
you talk to someone for a little bit because I think in pelvic floor physical therapy, some of it can be some kind of graded exposure, graded experiences. And that's
Hmm.
not only for your muscles and your tissues, it's, for you as a whole person. Um, and sometimes being able to talk to someone a little bit first or in the middle or during, or let's say you're trying to, get yourself ready for a really important uh SOP exam,
Yeah.
having a multidisciplinary team can just make things so much more comfortable. And I think for each person, it's different who
Yeah.
they might need to see a little bit more first at one time or the other, but it can make the whole experience so much more comfortable, which I think is
Hmm.
really important.
And the word that came to mind as you're describing all that is it can feel such a safe and empowering experience, rather than adding more medical trauma by maybe they kind of have that tough, I'll just tough it out and get through it. Like you're giving them
Mhm.
permission to say, you don't have to tough it out and get through it. We can support you. And, I love collaborating with PTs and saying, these are some ideas for down regulation we're going to practice. Does that sound good? Or, being able to bounce ideas off of each other so that they feel safe and there isn't a rush. I think in medicine, patients feel so rushed, but the beauty of having these one-on-one, practices that really can slow the pace down is that clients and patients can feel more autonomy too, which is really, really important.
Yeah, that can be really nice. And, I'm sure as you've seen, it can be such positive experiences for our patients. I think a lot of times, like you had said, you don't kind of have to like grit and bear it and tough it out. They've spent so
Yeah.
many years doing that.
Hmm.
And unfortunately, it hasn't been 100% helpful. So being able to take a different approach can be really nice.
Yeah. And Lauren, thank you so much for sharing your expertise and your time with us today. I just can't thank you enough for taking the time. And hopefully, someone hears this and thinks that there can be a different way, a more empowered and supportive way that they can navigate chronic pelvic pain. So, thank you so much for being here.
Yeah, and thank you so much for all that you do. As we just talked about, multidisciplinary care is so important, and, working together can just help to make such more positive experiences for everyone. So I really appreciate you taking the time for this as well.
Awesome. Thank you so much, Lauren.